Digital leaks occur the moment a secure organizational system interacts with an unvetted third-party tool. Data packets dissolve into a dark, unstructured void, an active operational failure that happens daily in nonprofits handling sensitive information. This graph illustrates a widening operational gap. 95% of nonprofit staff are already using AI tools for their work, while formal policy coverage remains stalled at 14%. This discrepancy creates shadow AI. When staff are forced to manage heavy workloads in under-resourced environments, they adopt informal, unauthorized tools to complete their tasks. They are not acting maliciously. They are simply trying to meet their deadlines. Consider the risk of a single prompt. A well-meaning caseworker pastes a client's medical history into a free language model to draft a case summary. That sensitive data is now stored by the provider, potentially used to train future models, or exposed in a data breach. Unchecked shadow AI converts benign administrative tasks into critical security vulnerabilities. The organization loses total visibility over the data it is legally bound to protect. Many organizations believe they are protected because an employee glances at an AI output before it is used. But passive observation is not oversight. Effective governance requires the active authority to change or reject a machine's decision. Possessing an AI acceptable use policy (PDF) often amounts to little more than an administrative filing task. If a policy sits unread on a server, it fails to influence the actual behavior of the staff using these tools. True human oversight requires concrete mechanics, specifically named owners for every tool, explicit thresholds for mandatory review, and documented escalation paths for when an AI makes an error. Securing these systems requires moving beyond one-time consulting reports. While a report lists what is broken, a continuous safety program installs the operational infrastructure to maintain control over the technology. Verifiable AI safety is achieved through the systematic implementation of the AI Care Agents 247 framework, a 10-step process designed to engineer human authority back into the digital workflow. Phase 1 begins with discovery and mapping. In Step 1, we conduct an intake process that anchors all subsequent risk analysis to the organization's specific mission and the vulnerability of the people they serve. The stakes of AI use change based on the mission. Step 2 builds the use case inventory, expanding the blueprint to capture every officially sanctioned software platform. Then, the discovery of shadow AI reveals unmonitored tools operating outside of official oversight. We capture critical metadata for every tool: the vendor, the internal owner, the stated purpose, and the exact data types involved. Step 3 is data mapping. We trace the movements of data between systems and external vendors to identify how sensitive information travels. We ask, if this vendor disappeared tomorrow, what would break and what data would be stranded or exposed? Mapping the vascular system of organizational data exposes the hidden points where benign AI tools interact dangerously with confidential files. Phase 2 focuses on risk and oversight mechanics. In Step 4, we evaluate the impact of each use case. Drafting a donor email is low stakes. An AI algorithm influencing eligibility triage is high stakes. Transparency is becoming a legal requirement across the United States. Organizations must provide a clear avenue for recourse and human review for any individual affected by an AI-influenced decision.
Step 5 is the human oversight assessment. We determine if the designated human reviewer possesses the actual authority to reject an AI's output, or if the review process is merely a checkbox. High-risk tools paired with weak or fake oversight represent the primary failure point this framework is designed to eliminate. Step 6 moves to policy review. We look for behavioral evidence, proof that staff actually understand the rules and use them to guide their daily interactions with AI. In Step 7, every tool is strictly categorized into risk tiers. High-stakes decision-making nodes turn red, while low-stakes drafting tools are marked green. We replace vague anxieties with specific harm modes, documenting exact risks, like privacy leaks or algorithmic blind spots, attached to real tools. Tiering these specific harms turns an abstract threat into a measurable management agenda that a board or funder can act upon. Phase 3 is remediation. Step 8 distills all findings into a gap register, a structured list of problems with assigned owners and hard deadlines. Beside it, the maturity score provides a fast, visual summary of the organization's governance strength for stakeholders who need an immediate overview of critical gaps. Step 9 delivers the blueprint. This sequences every required fix into 3 time horizons: immediate, near-term, and strategic. We pause unsafe tools immediately, vet high-risk vendors in the near term, and build board-level oversight structures to ensure long-term resilience. Step 10 is the handoff. This is the moment where theoretical governance is installed as a physical, operational reality. We build containment boxes around high-risk nodes. These are physical authorization gates and audit logs that record every human intervention, creating a permanent record of oversight. Before completion, we establish rigid reassessment dates. This ensures the safety program evolves alongside the technology, rather than becoming a static report. Step 10 serves as the dividing line between an awareness campaign and a safety program that physically engineers a defense against AI risk. AI models update and staff turnover occurs. These changes mean a governance structure must remain active to be effective. The ongoing phase focuses on continuous training. Staff must understand which tools are approved, while supervisors must know how to identify new risks. We train supervisors to treat the discovery of new shadow AI as a corrective operational issue. If disclosure is punished, the organization loses its ability to see and manage its own risks. Continuous monitoring ensures that review logs are being completed and that the organization can generate a clean report for a funder or auditor at any time. Without active log reviews and scheduled reassessments, even the most rigorous architecture will eventually decay into obsolescence. The ultimate output of this ongoing process is audit-ready reporting. These standardized packets compile your data maps, risk assessments, and review logs into a single source of truth for external stakeholders. These records protect the mission. Algorithmic discrimination in grant allocation or case prioritization directly harms the vulnerable populations nonprofits exist to serve. While a consulting report merely identifies system failures, a human-supervised safety program installs the permanent infrastructure required to correct them. In a sector where trust is the primary currency, verifiable, documented human authority over AI acts as the final safeguard for the organization's mission and integrity.